ask the second speaker, Dr. Anuj Mittal. Dr. Anuj Mittal is head of the department psychology, psychiatry at Deen Dayal Upadhyay Hospital, and he's going to talk on psychological impact of COVID and lockdown. And discussant for the talk is Dr. Jagdish Rana. Over to you, Dr. Anuj, all yours.
Thank you. Can everybody see me on my screen?
Yeah, we can see you, Anuj. You can share screen.
Yeah, can you see my screen now?
We can't see your slides.
You can't see my slides?
Share your screen, sir.
I have shared the screen. Can you see my slides?
Yes, sir.
Yeah, we can see, sir. Please.
Yeah, good afternoon, everybody. Last 1.5 years, we are all going through the COVID and its related problem. WHO declared COVID as a pandemic in the March 2020. And most of the health authorities were really focusing on the increase, the amount of the diagnosis, and the management and the contact tracing, and on the later phases, regarding the prevention, and which is of course by the vaccination. But there was a very little focus on the mental health or the psychological health of the people who were going through this all pandemic. Now, if you see psychologically, there are various group of people, the different group of people who have been affected differently by their circumstances. There was general population, there were healthcare professionals, there were people who were isolated in the quarantine, people who were COVID positive and recovered, and people who already had psychiatric or psychological problems, and long-term impact on all the groups. Now, psychological and behavioral responses of the general population in the lockdown there was increased anxiety and fear in everybody. And they were really worried about the health of the self and the loved one. And everybody was concerned that I may contract the illness, or my close family member may have contracted the illness. There are symptoms of low and irritable mood, anger and frustration, restlessness and agitation. And as predicted, there was increased conflict with the family members because most of the family members were working from home, or they were at home. Most of the children were at home. Therefore, there was increased conflict for their space at the home, their agreement and disagreement. Increased use and withdrawal of the alcohol and tobacco. Since alcohol was not available to people who were actually dependent on the alcohol, they had few withdrawal symptoms initially. And when it became available after the opening of the first lockdown, people started storing the alcohol and the tobacco related products. So in this second lockdown, there was a sharp increase in the use of the alcohol and tobacco. Sleep related issues, as predicted, people were going to sleep late and getting up late. There was difficulty in the sleep, concentration problems and impaired daily performance because they were at home, working from home. So there was no hurry to get up, no hurry to go to office. There were racing thoughts, especially the negative thoughts related to the COVID, whether what will happen to that COVID. Feeling of helplessness of being not able to do what everybody was doing every year, going out with the family members, going to their places frequently, going for traveling. Those all things has stopped. Suicidal tendencies developed, and few may develop syndromal disorders such as depression and anxiety and trauma-related disorder that require the formal treatment. One thing I'll add here is a word is known as infodemic. Means there was excessive exposure regarding the information regarding the COVID. That also led to a lot of anxiety and apprehension because all news are not relevant and not authentic, all sources. So many things has happened in last 1.5 years. Now, let's look at the population who were isolated in the quarantine. They showed symptoms of anxiety, low mood, irritability, emotional exhaustion, being in the same room for a very long time, unable to do any physical activity, no exposure to the light, and inability to sleep. There were difficulty in the sleep. Trauma and stress-related symptom, because there were uncertainties that how their day-to-day needs will be needs will be met, and their day-to-day medication, their looking after, who will give them food. So this was happening in so many houses. Few people committed suicide because of the loss of job, the loss of financial things, their depression, and related complications of the COVID. These symptoms could outlast the period of quarantine in the vulnerable population. Last 1.5 years, we have seen so many people, let's say 99% people who had COVID recovered from the COVID. But after the recovery, many of them reported the cognitive and memory related problems. Many doctors who recovered from COVID, they came to me and said, yeah, there are difficulty in focusing, in concentration, in taking the clinical decisions. So that was a very important factor. But ultimately, it improved itself after 4 to 6 weeks. Sleep disturbances, anxiety and panic symptoms, of course, because when you recover, you just think about what will happen if I contact it again, and what will happen if this happened to my family members. Prolonged fatigue. After infection, even 3-4 months of fatigue, people are reporting. Body pains, helplessness and hopelessness, because they were not seeing any end of the pandemic. Although vaccine had some positive influence, some hope, but still. Long-term psychological impacts of the COVID were seen in the terms of post-traumatic stress disorder, in which there are the anxiety symptoms and recurrent thought regarding the COVID, and there is always a fear that I may be infected. Anxiety problems, which includes the panic and palpitation and sweating, drug abuse and dependence. In the United States, it has been found that last 1 year, the sale of the cannabis increased multifold. See, because of the lockdown, people were inside the home. The increased use of the various kind of drug were there. Depression, adjustment problem to the new environment. Everybody has to work from home, and few people lost their businesses, their jobs. So adjustment problems were likely to happen. Special emphasis on all of us healthcare professionals. Increased patient demand during 1.5 years, risk of acquiring infection to the self and the family members. Equipment related challenges. So many people were working in the corona wards, wearing PPE, wearing masks, wearing various kind of protective gadgets. And also imagine about a person who's in the ICU and looking after the patient on the 3 types of the ventilators, and emotionally challenging experiences like death around and suffering around, in which they can't help so much that they want to. This is a psychological first aid tool which was developed by the Canadian Psychiatry Association and recommended by WHO now for specifically COVID-related anxiety. This is for the general population. ABC123. This is available online. Anybody who has an anxiety, stress which is related to COVID should just log in and just type ABC123 psychological first aid tool. You will get all the information. This is very easy to see. It's a self-administered tool. When to consult a psychiatrist or a psychologist or a mental health expert during the corona periods, when there is excessive sleep related issues like delayed sleep cycle, insomnia or hypersomnia, uncontrolled anxiety, palpitation, restlessness, agitation, panic, excessive sweating, moderate to severe depression like helplessness, hopelessness, suicidal behavior, suicidal ideation, alcohol or illicit drug related abuse.
Yeah, I'm there now.
Excessive use of alcohol and drug related issues like tobacco, cocaine, cannabis, opioids, then that individual should need help. Post-traumatic stress disorder, as I discussed, unresolved grief, which is a very important issue because many people lost their loved one. Just a minute only. Unable to cope with the death of the family members. I'll take half a minute. Unable to cope with the death of the family members and the friend. There was a survivor guilt, which we know that I have been survived, my close family member has died, and I'm unable to help my close family members as I should. Worsening of the existing psychiatric symptoms. Therefore, these are the these are the main guidelines when we should expert a mental health professional. Now, we all know that this corona pandemic will remain with us. Waves will come and go. Let's see how much vaccination we can do. This is in the last 1.5 years we have seen this is one of the worst pandemic of human history in 100 years. It has a very
Anuj, can
large
you summarize, please?
psychology or well-being of the large segment of the population. We need to increase the awareness and availability of the psychological support for everyone. Thank you. Thank you, Dr. Balla.
Yeah, thank you. That was a very wonderful presentation, Dr. Anuj. I would invite the discussant, Dr. Jagdish Rana, for talk of Dr. Anuj. So, a few questions for you, Dr. Jagdish.
Yeah.
Yeah. So how do you think this COVID pandemic and lockdown has affected ophthalmic patients psychologically?
You are asking me to Dr. Anuj Mittal?
Yeah, Dr. Jagdish Rana, please. Dr. Jagdish.
Yeah. At the outset, Dr. Balla, thank you very much for inviting me in this COVID aftermath discussion. So this COVID has affected massively to the ophthalmic patient in a especially second wave. And especially the fear of the mucormycosis is very much there. I have got at least more than 50% patient in my OPD practice during these mucor cases, especially in the Gujarat, where the mucormycosis cases has been tremendous. And even we thought without the COVID, patient who has got the COVID, they are also coming to that where they are able to get COVID or mucor, or even patient without COVID or with COVID, both are coming. And especially they are afraid of either getting mucormycosis or either they are chances of getting removal or enucleation of the eyeball. They are very much afraid of enucleation of the eyeball. That's why they are coming very much frequently. So in my opinion, in my practice, 50% of patients, because of fear of mucor and enucleation of eyeball, they are very much affected. Yeah.
How do you handle their stress levels, sir, of these patients?
Yeah. First is the friendly approach is very much needed. We have to approach them friendly as if we are a family friend of their patient. Second thing is a scientific approach. We have to examine, we have to rule out all possibilities of other COVID-related issues. And if everything is normal, then we have to explain that we are not having a mucor or any other infection, or not even chances of getting this infection. Second thing is we have to investigate. In some cases, if we find out some doubt of a arterial occlusion or venous occlusion, or a doubt of a mucor, then we have to ask for the HRCT or a CT scan PNS as well as D-dimer level. If these are also normal, then you have to explain that you are not having any chances of getting loss of the vision or enucleation of eyeball. And regular follow-up at a short interval is also very much important to handle this patient space.
I think very rightly said. I'll thank both Dr. Jagdish Rana and Dr. Anuj for excellent talk and